Welcome to Business Connection. I'm Liz Spencer. Joining me now from Innovative Orthodontic Centers is Dr. Manal Ibrahim. Welcome, doctor.
Thank you so much for having me.
So let's jump right in. You recently had a really big honor. Tell me about it.
Yes, it's really exciting. Invisalign told us that we were the #1 orthodontist Invisalign provider in Illinois, which is really cool.
What does that mean to you, and what does that mean for your patients and the care you give?
For me, it means that I'm eternally grateful to all our patients for trusting us with their care. It means that we've provided Invisalign treatment for over 5,000 people,
Wow.
which is really cool. And for our patients, it means that they can trust us, that we have the experience to provide orthodontic care with Invisalign or braces, not just a pretty smile, but we're taking care of everything else orthodontically, so they can trust us to give them the results we promise. The reason that Invisalign is so phenomenal is because it encases the teeth in all 3 planes of space. You can move them all at once.
Okay.
So you don't really have to worry about the typical staging of treatment that you would with braces. In other words, with braces, you can't start rubber bands from day one. With Invisalign, you can. So you could jump in and start making so many corrections so early on that braces just could never offer you. And that's the love I have for Invisalign. It's not because it's clear. That's why patients love it. It's not because it's a clear plastic removable device, but because of what it can do for my patients. It's changed my life as an orthodontist because I'm able to offer patients treatments that I could never have dreamed of with braces alone. Having said that, we still do a tremendous amount of braces treatment for our patients because when my patients come in, I'm not going to tell them you're only a candidate for braces or you're not a candidate for Invisalign. I give them what they want. I say, what do you want? Do you want braces or do you want Invisalign? And that's what they get. So I'm not locking anybody into any treatment type, but I do tell them you can get whatever you want, what fits your lifestyle, because that's really the determining factor in our office.
Did you always want to be an orthodontist?
Funny question. No, actually, that was not my plan at all. It was by default that I got here.
Well, tell me a little bit about what you love about it, and do you think it was one of the best decisions you've ever made?
The absolute best decision I ever made to become an orthodontist. It definitely fits my personality. It fits my lifestyle in terms of just wanting to engage with patients and make them happy and give them the most aesthetic and functional result that I can orthodontically. So, yeah.
And when we say orthodontics, tell me a little bit what that is and how does that differ from the regular dentist?
So an orthodontist is a specialist who does complete a program for 2 to 3 years after dental school, and it focuses only on orthodontics as well as jaw growth and development. So it's orthopedic as well as orthodontic. And so we do have the training to treat patients of all ages with growth and development, and then fine-tuning, tooth positioning, being a little bit proactive versus reactive. That's the specialty.
That's awesome. Well, because I think people often don't think of all the mechanics that go into a healthy mouth and, and teeth, and they think a healthy smile, but if we don't have a good bite, if we're not, if we have too much space or not enough space, lots of things get impacted.
We have to understand that if your teeth are crooked, you can't floss them properly. If they have big spaces, the floss can't get the food out of there.
Right.
So how do we maintain the health of our gums and our bone? We have to make sure that we can clean the teeth really well, that food can't get stuck in there. If the bite is off on one side or another, that means we're putting too much force in one area. We could wear and tear the teeth, they could fracture. So again, it all goes back to, can we get the teeth in the most ideal position relative to their bone and to each other so that they can kind of live happily ever after and we can keep them healthy and clean and happy. That's really what orthodontics is about. Again, a lot of people think, I just want to get my smile improved. Yes, I do too. I want to get your smile improved, but there's so much more to orthodontics than just what you see in the mirror.
What is it about the Naperville community that you love so much?
Well, my husband and I moved here and we opened a practice here because we knew that it was the best place to raise children. And it has truly been remarkable networking with local business owners, families, our patients. It's been a really rewarding place to live and practice.
You're located right downtown, correct?
Correct. We are in the Main Street Promenade right above Hugo's Frog Bar. Everyone knows Hugo's, so we're right up on the second floor. And we do have also a pediatric practice called Innovative Pediatric Dentistry, and our Naperville dental specialists, which is general dentistry coupled with prosthodontics, implants, oral surgery, endodontics, periodontics, anything you need done with your teeth, as well as, of course, the orthodontics there.
Share with our viewers a little bit, what's the proper age for a child to be thinking about coming to see you?
Thank you for asking me, because that is one of my huge passions, actually. And it is recommending that patients come in at the age of 7. Okay. And that is sort of a guideline that the orthodontic organizations have asked us to share with our patients, because we can identify so many issues at the age of 7 when the 6-year molars first come in. And there are certain benchmarks that we look at in terms of the growth and development. And so we are identifying if everything is going accordingly or if there are issues that we need to address right then and there. Oftentimes we see patients for 4 or 5 years before we even recommend orthodontic care. So we're not looking to do care at that age. We're just looking to do a really good diagnosis and screening. And then we see our patients usually once a year after that.
That's awesome. Well, it kind of goes to my follow-up question that if people want to get in contact with you, how do they do that? And do they need, what's going to happen? They there for, do they come in and get serviced right away, or is it more of a consultation type of deal?
Yep, so our patients come in for complimentary consultations. We do take photographs and x-rays. We have a 3D x-ray machine with very low radiation, so it can detect a lot of different things that we can't really see in the traditional old school kind of x-ray. Mm-hmm. And then if they are needing some treatment, we're able to recommend Invisalign or braces. If they're not ready for treatment, we do see them once a year until they are ready. All these appointments and visits are complimentary. We have things on our radar that we might be watching, high-risk situations where teeth might get damaged. So we have those items written down and we check them at every subsequent visit. And we do love to see our patients as often as we need to until treatment may be necessary. We do also recommend additional services. So sometimes patients come in and they're not happy with their smile, and orthodontics alone may not take care of it. So we may recommend that orthodontics would be one finish line to get you to maybe veneers, some cosmetic dentistry, some implants. And we do want to do comprehensive care in our office, not just kind of band-aid an issue, but we just want you to have long-term, lifetime benefit and a good quality of life with the recommendations we give.
That's awesome. I do think, and it goes back to your thought on dental care. It's a lifetime, so that's really great that you guys are taking care of us and looking that long-term picture. So
regardless of the age, we do like to do that. Yes.
That's awesome. That's awesome. Thank you so much for all that you do for the community. Your practice and you and your husband are a great addition to the business community down there.
Thank you so much.
And it's so vital. You were offering just great vital service. So thank you so much for taking time out of a busy day and coming to Business Connection.
Thank you so much for having me.
And we're going to be right back with more Business Connection.